Hello everyone, my name is Ren Biliu and I'm an MFT student at Pepperdine University. Today we're going to go over reality therapy and how this therapy is based off of choice theory. So choice theory was developed in the 1960s by a man named William Glasser, who was actually a psychiatrist at the time. Today my goal is to clearly explain what choice theory is, how it connects to reality therapy, and how that therapy works, and give you guys a real life example of this. So what is choice theory? In order to understand reality therapy, we have to first understand choice theory as it's the heart of reality therapy. Choice theory has the foundational belief that you cannot control others, you can only control your own behaviors, choices, and attitudes. Now, William Glasser, the same man behind choice theory, believed that a lot of problems came about when people tried to control others or when people felt that they were being manipulated or controlled themselves. So choice theory argues that there are 5 basic human needs that everyone strives for, which are survival, love and belonging, power, freedom, and fun. And all human behavior is driven by these needs. Survival is connected to our health and safety, while love and belonging pertains to our connection with others. Power can also be seen as achievement, while freedom is interpreted as having autonomy or being able to make your own choices. Finally, your last basic need is fun, which is simply your pleasure in life. In choice theory, the belief is that when one or more of these basic needs isn't being satisfied, we will begin to experience psychological distress. Reflecting on the name, choice theory stresses that fact that despite our inability to change the circumstances that we're in, what we do have is the ability to change how we think and respond in order to better satisfy those basic human needs. So what is reality therapy? Now with some foundational knowledge of choice theory, I can begin to explain the basis of reality therapy. Reality therapy was also developed by William Glasser as a therapy approach that would put choice theory into effect. This therapy is described as being present-focused and having a hands-on approach. This approach has a strong emphasis on teaching clients to take responsibility for their own decisions and to instead focus on finding more productive coping skills that help them achieve their needs. Reality therapy uses its present focus to help a client shift from the past to what choices they're making now and if these choices are effective in getting their needs met. Therapists do this by helping clients gain more self-awareness into these choices and again, get them to ask themselves if these choices are working for them. This in turn helps a client obtain more responsibility and self-awareness, leading to reality therapy's goal of reaching self-efficacy and the client having a satisfactory life. Beyond this, reality therapists also shift their focus from any symptoms to more so the cause and how this behavior can be changed by the client, all in a non-judgmental manner. While there are quite a few notable techniques and interventions used in the process of reality therapy, one of the most basic systems used widely is what's called the WADEP system. So the WADEP system stands for wants, so meaning what is it that you want or what are your goals? Doing, what are your behavior choices right now that you're doing? Evaluation, are these things working for you to meet your needs? And finally, plan, which also asks what the plan is moving forward for a different outcome. During this process, while therapists use the WADEP system, the therapists work closely with the client to dive deep into these questions and then create practical, measurable, and realistic steps. In reality therapy, a plan is created out of the client's responses to these questions, and these plans must be specific, doable for the client, and most importantly, within the client's control. A good example of this would be, I'm going to revamp my resume and have someone critique it before I turn it into 5 different places, as opposed to, I'm going to get a job. The latter gives 0 detail into how one would go about achieving this goal and is out of their control. The therapist stance. In reality therapy, therapists work to create a safe, non-judgmental environment where they're also genuine and supportive, but with an element of challenge. This also means that an important amount of time is taken to build a strong and trusting alliance between therapist and client to build a solid foundation for change. Once a strong union has formed between therapist and client, reality therapists do not blame their clients, but they also do not accept excuses and they will not process the past. Instead, with its present focus, clients are more geared towards the idea of what can be controlled today and moving forward. This approach by reality therapists is meant to be empowering to clients and to help view themselves as being able to make better choices that align with their goals. To better imagine what reality therapy in action might look like, here's a short example. So we have our client Sophie, who is a 25-year-old woman who's seeking therapy due to feeling anxious and disconnected in her relationship. She spends a lot of time by herself and is isolating from her partner. In this situation, a reality therapist might spend a portion of the session like this. Therapist: Sophie, what is it that you want right now? I want to feel more connected to my partner again. Can you tell me what you're doing to achieve that? I keep waiting for them to approach and engage with me. I see. And how has that been working for you so far? Well, since I'm feeling anxious and disconnected still, I don't think it is working. What would be a small thing you could change that would make a difference throughout this week? I could make a plan to ask my partner to have dinner this week at home with no electronics. In this small excerpt, we get to see Sophie take on responsibility of her own choices and then create a specific and attainable plan that is also within her control, and all with the goal of meeting one of her basic human needs of connection. In order to make a quick summary, choice theory was created to better help us understand why we make the choices we make, and then the implementation of reality therapy allows us the ability to make changes to our behavior and choices that then be able to meet our needs in an effective way. With its strong emphasis on what we can control and remaining in the present, reality therapy continues to do an amazing job in helping people achieve their goals effectively, cultivate strong relationships, and most importantly, have a satisfying life. Thank you for watching. This concludes my presentation on choice theory and reality therapy.